Acne is a skin condition that occurs when your hair follicles becomes plugged with oil and dead skin cells. Acne usually appears on your face, neck, chest, back, and shoulder. Effective treatments are available, but acne can be persistent. The pimples and the bumps heal slowly, and one begins to go away, other seems to creep up. Acne is the most important among teenagers with a reported prevalence of 70 to 87%. Increasingly, young children are getting acne as well. Depending on its severity, acne can cause emotional distress and scar the skin. The earlier you start treatment, the lower your risk of lasting physical and emotional damage. Symptoms. Acne signs and symptoms vary depending on the severity of your condition. Whiteheads, closed plugged pores. Blackheads, open plugged pores. The oil turns brown when it is exposed to air. Small red tender bumps, papules. Pimples, pustules, which are papules with pus at their tips. Large, solid, painful lumps beneath the surface of the skin, nodules. Painful, pus-filled lumps beneath the surface of the skin, cystic lesions. Causes. Four main factors cause acne: oil production, dead skin cells, clogged pores, bacteria. Acne typically appears on your face, neck, chest, back, and shoulder. These areas of skin have the most oil sebaceous gland. Acne occurs when hair follicles become plugged with oil and dead skin cells. Hair follicles are connected to oil glands. These glands secrete an oily substance, sebum, to lubricate your hair and skin. Sebum normally travels along the hair shafts and through the openings of the hair follicles onto the surface of your skin. When your body produces an excess amount of sebum and dead skin cells, the two can build up in the hair follicles. They form a soft plug, creating an environment where bacteria can thrive. If the plugged pore become infected with bacteria, inflammation results. The plugged pore may cause the follicle wall to bulge and produce a whitehead, or the plug may be opened to the surface and may darken, causing a blackhead. A blackhead may look like a dirt stuck in pores, but actually the pore is congested with bacteria and oil, which turns brown when it is exposed to the air. Pimples are raised red spots with a white center that develop when a blocked hair follicle becomes inflamed or infected. Blockages and inflammation that develops deep inside hair follicle produces cyst-like lumps beneath the surface of your skin. Other pores in your skin, which are the openings of the sweat glands, are not usually involved in acne. Factors that may worsen acne. These factors can trigger or aggravate an existing case of acne. Hormones. Androgens are hormones that increase in boys and girls during puberty and cause the sebaceous glands to enlarge and make more sebum. Hormone changes related to pregnancy and the use of oral contraceptive also can affect sebum production, and low amounts of androgens circulate in blood of women and can worsen acne. Certain medications, drugs containing corticosteroids, androgens, or lithium can worsen acne. Diet. Studies indicate that certain dietary factors, including dairy products and carbohydrate-rich food, such as bread, bagels, and chips, may trigger acne. Chocolate has long been suspected of making acne worse. A recent study of 14 men with acne showed that eating chocolate was related to an increase in acne. Further study is needed to examine why this happens or whether acne patient needs to follow specific dietary restrictions. Stress. Stress can make acne worse. Acne myths. These factors have little effect on acne. Greasy foods. Eating greasy food has little to no effect on acne, though working in a greasy area. such as kitchen with dry vats does because the oil can stick to the skin and block the hair follicle. This further irritates the skin or promotes acne. Dirty skin. Acne is not caused by dirt. In fact, scrubbing the skin too hard or cleansing with harsh soaps or chemical irritates the skin and can make acne worse. Though it does help to gently remove oil, dead skins and other substances. Cosmetics. Cosmetics do not necessarily worsen acne, especially if you use oil-free makeup that does not clog pores. Non-cosmetogenics and remove makeup regularly. Non-oily cosmetics do not interfere with the effectiveness of acne drugs. Risk factors. Risk factors for acne include hormonal changes. Such changes are common in teenagers, women and girls, and people using certain medications, including those containing corticosteroids, androgens, or lithium. Family history. Genetics play a role in acne. If both parents had acne, you would likely to develop it too. Greasy or oily substances. You may develop acne where your skin comes into contact with oily lotions and creams or with grease in a work area, such as kitchen with fry vats. Friction or pressure on your skin. This can be caused by items such as telephones, cell phones, helmets, tight collars, and backpacks. Stress. This does not cause acne, but if you have acne already, stress make it worse. Treatments and drugs. If over-the-counter non-prescription products have not cleared up your acne, your doctor can prescribe stronger medications or other therapies. A dermatologist can help you. Control your acne. Avoid scarring or other damage to your skin. Make scars less noticeable. Acne medications work by reducing oil production, speeding up skin cell turnover, fighting bacterial infection or reducing inflammation, which helps prevent scarring. With most prescription acne drugs, you may not see results for 4 to 8 weeks, and your skin may get worse before it gets better. It can take many months or years for your acne to clear up completely. The drug your doctor recommends depends on the type and severity of your acne. It might be something you apply to your skin, topical medications, or take by mouth, oral medications. Often drugs are used in combination. Pregnant women will not be able to use oral prescription medications for acne. Talk with your doctor about the risks and benefits of medications and other treatments you are considering. Topical medications. These products work best when applied to clean, dry skin about 15 minutes after washing. You may not see the benefits of this treatment for a few weeks, and you may notice skin irritation at first, such as redness, dryness, and peeling. Your doctor may recommend steps to minimize these side effects, including using a gradually increased dose, washing off the medications after a short application, or switching to another medication. The most common topical prescription medication for acne are retinoids. These come as creams, gels, and lotions. Retinoid drugs are derived from vitamin A and include tretinoin, adapalene, and tazarotene. You apply these medications in the evening, beginning with 3 times a week, then daily as your skin becomes used to it. It works by preventing plugging of the hair follicles. Antibiotics. These work by killing excess skin bacteria and reducing redness. For the first few months of treatment, you may use both a retinoid and an antibiotic, with the antibiotic applied in the morning and the retinoids in the evening. The antibiotics are often combined with benzoyl peroxide to reduce the likelihood of developing antibiotic resistance. Examples include clindamycin with benzoyl peroxide, benzacillin, and erythromycin with benzoyl peroxide, benzamycin. Dapasone. This gel is most effective when combined with topical retinoid. Skin side effects include redness and dryness. Oral medications, antibiotics for moderate to severe acne. You may need oral antibiotics to reduce bacteria and fight inflammation. Choice for treating acne include tetracyclines such as minocycline and doxycycline. You will likely use topical medications and oral antibiotics together. Studies have found that using topical benzoyl peroxide along with oral antibiotics may reduce the risk of developing antibiotic resistance. Isotretinoin. This medication is reserved for people with the most severe acne. Isotretinoin is a powerful drug for people whose acne does not respond to other treatments. Therapies. These therapies may be suggested in a select cases, either alone or in combination with medications. Light therapy. A variety of light-based therapies have been tried with success, but further studies needed to determine the ideal method. Light source and dose. Light therapy targets the bacteria that cause acne inflammation. Some types of light therapies are done in a doctor's office. Blue light therapy can be done at home with a handheld device. Possible side effects of light therapy include pain, temporary redness, and sensitivity to sunlight. Chemical peel. This procedure uses repeated applications of a chemical solution, such as salicylic acid. It is the most effective when combined with other acne treatments, except oral retinoids. Chemical peels are not recommended for the people taking oral retinoids because together these treatments can significantly irritate the skin. Chemical peels may cause temporary severe redness, scalings and blistering, and long-term discoloration of the skin. Extractions of whiteheads and blackheads. Your dermatologist uses special tools to gently remove whiteheads and blackheads that have not cleared up with topical medications. This technique may cause scarring. Steroid injection. Nodular and cystic lesions can be treated by injecting a steroid drugs directly into them. This improves their appearance without the need for extraction. The side effects of this technique include thinning of the skin, lighter skin, and appearance of small blood vessels on the treated area. Treating acne scars. Procedures used to diminish scars left by acne include the following. Soft tissue fillers. Injecting soft tissue fillers such as collagen or fat under the skin and into the indented scars can fill out or stretch the skin. This makes the scar less noticeable. Results are temporary, so you would need to repeat the injection periodically. Side effects include temporary swelling, redness, and bruising. Chemical peels. High potency acid is applied to your skin to remove the top layer and minimize deeper scars. Dermabrasions. This procedure is usually reserved for more severe scarring. It involves sanding the surface layer of the skin with a rotating brush. This helps blend acne scars into the surrounding skin. Laser resurfacing. This is a skin resurfacing procedure that uses a laser to improve the appearance of your skin. Light therapy. Certain laser, pulse light sources, and radio frequency devices that do not injure the epidermis can be used to treat scars. These treatments heat the dermis and cause new skins to form. After several treatments, acne scars may appear less noticeable. This treatment has shorter recovery times than some other methods, but you may need to repeat the procedure more often and results are subtle. Skin surgery. Using a minor procedure called punch excision, your doctor cuts out individual acne scars and repairs the hole at the scar site with stitches or a skin graft. Lifestyle and home remedies. You can also use these acne prevention tips. Wash acne prone areas only twice a day. Washing removes excessive oils and dead skin cells, but too much washing can irritate the skin. Wash affected areas with a gentle cleanser and use oil-free, water-based skincare products. Use an over-the-counter acne cream or gel to help dry excess oil. Look for products containing benzoyl peroxide or salicylic acid as the active ingredients. Use non-oily makeup. Choose oil-free cosmetics that would not clog pores, non-cosmetogenic. Remove makeup before going to bed. Wear loose-fitting clothing. Tight-fitting clothing traps heat and moisture and can irritate your skin. When possible, avoid tight-fitting straps, backpacks, helmets, hats, and sports equipment to prevent friction against your skin. Shower after strenuous activities. Oil and sweats on your skin can lead to breakouts. Avoid touching or picking at the problem area. Doing so can trigger more